Everybody, we are live today and we are going to be joined by Noelle from Motherhood and Meals. I haven't done a live with Noelle and I think over a year, so very exciting to be doing one today. And our topic that we get to discuss is, I should probably read it, iron and the gut for the whole family. So we're going to talk about nutrient deficiencies, our digestive system, and everything we need to know, and some tips and tricks from, oh, there we go. I was like, it's happening. I know she's there.
Happening.
Welcome. Thank you so much, Noelle, for being on our live today. And of course, talking about nutrient deficiencies, iron deficiencies, and the gut.
The things you and I love to talk about, really.
I know. I was like, it better have iron in the title.
Always.
I'm like, that's my favorite topic. So I want to make sure everybody knows who's following KidStar about Noelle. So Noelle is a registered dietitian with a master's of science in food nutrition. And of course, you're a mom of 3 boys. So I got my 3 girls. You got your 3 boys.
Yes.
And you're also passionate about educating and inspiring others in areas related to nutrition and overall health. So thank you so much for joining us today, Noelle.
Thanks for having me. And you have your 3 girls, I have my 3 boys, but it looks like we both spent a lot of time at the rink this weekend.
I was like, oh, look, a different view. Oh, the same view, but different rink, different child.
Same.
It was actually really funny because at one point I looked down because I was sitting up higher with my 2 girls and then they were playing. And I looked down and they were hugging for like half a second next to the rink. And then, oh, don't worry, it didn't last long. And then I looked again and they were like wrestling. And I just looked at the other mom and she was like, well, they're together.
There you go.
They're being
They're
safe.
bonding.
I was like, I just eyed them. I'm like, it's not your game.
I'm watching you.
It's right. But it's the joys of the kids being brought to all the sibling sports. Yeah. They totally have to say.
We were the opposite this weekend. So my twins were 3 hours north of where we live. And my youngest was 3 hours south of where we live. So we divided and conquered for 2 different tournaments this weekend.
That's a lot. And like someone said to me, where are you going? And I'm like, we're going to hockey. And they're like, where is it? And I'm like, actually, our home rink for one of our kids is in a different city because we just don't have as many rinks in Vancouver. So it's not far, but it's still in another city. And then we got there and there was a huge tournament happening for different ages. And I'm like, hey, it's busy. I'm like, Canada loves hockey because that's basically where everybody is all winter. So
yeah,
it is. They love it. I love organized sports. So, it's a win-win.
I agree.
But we should. It's a nice segue. The more our kids work out, the more sweat and everything they're losing. They need more nutrients, right?
Yeah. Absolutely. And I find, when you're raising athletes, they need that extra boost of iron. They need an extra boost of a lot of things. But iron is one that I find with both my children, and I work with a lot of young athletes kind of in the age of 8 to 14. And it can make such a significant difference because children sometimes don't even know what normal energy level can feel like. And when we look at children and they're running around, we think, oh, they have so much energy, but that's not always the case, right? They're just running around because they're kids. It doesn't mean they feel their best. No. And I do find that the tablet, sometimes it tastes liquid, but a lot of them really like the tablets. They taste good. Make a big difference for a lot of the younger athletes I work with.
And it's very true. So my oldest is in U13, and of course, girls when they begun, the word is not coming to me, menstruation, if you have low iron, then, when that starts happening and you have all the sports added onto it, it's really hard to keep those iron levels up.
Absolutely.
Yeah.
Yeah,
so
absolutely.
Don't forget about your girls in sports.
Mm-hmm.
Yeah.
I know. And it's the energy for so many things, right? Like young athletes, they're at school all day. They've got to get their homework done. They're out on, whether it be the rink or the sports field or whatever it is, they've got this social stuff going on. And you're right. Once they start menstruation, they're losing so much iron on a regular basis, right? Like several days out of the month. And sometimes they may go into it already in a deficit.
Yeah.
Right?
Yeah. So it's true.
Yeah, a really important one.
It's all the things that we add into their daily. When you were saying that, I was like, wow, it's so much. You're at school, then you get home, then you go here, then you go there, then you do this, and then you get home.
Yeah.
and you're just like, okay, I'm done. And you're right.
Yes.
Maybe they don't realize how exhausted they are,
Hmm.
or that that activity level isn't where it should be because they're so busy.
Yes. Yes, that's exactly it. And the other thing I have found, perhaps you're the same, is that when meals and snacks are on the go, they tend to be the lower iron snacks, like yogurt and granola and fruit, which is awesome, or a smoothie. Like it's great. It's just they're usually so often either milk or
Yes.
milk alternative, like even a plant-based version, based. Not necessarily, like not a lot of some people take a hard-boiled
Yeah.
egg, but not a lot of people are taking
Not a
like a
lot of
chicken
people.
skewer, right? Like it's just
True.
not as common to find. So, or a peanut butter sandwich, like a bit is in there, but it's not as absorbable. So I do find it's a lot easier to build up on some of those bone building nutrients than it is for the
Yeah,
iron.
that's very true. Yeah, the grab and go is not normally iron rich foods.
No, it
Yeah.
just isn't. Maybe that's a new trend we could start. Like grab the chicken skewer
Yeah.
on the way out the door.
You're like, just grab a paper towel. You're fine. Just take
You're
it and
fine.
go. Just go. It's true. I'm
And
trying to
that's
make, I'm like, just take the bowl of pasta. There's meat sauce in there. Just take it with you. And they're like, I don't want to eat it in the car. I'm like, eat it in the car. I'm like, we need to do something. We need to eat something.
yes, yes,
Yeah.
exactly.
It's a lot.
Exactly.
So
Yeah.
when we're looking at, or when you see clients come in, what's the most common, I guess, signs and symptoms that people start telling you that kind of like, okay, these are nutrient deficiencies. We should look at X, Y, Z.
So I find that a lot of parents will say, my child is really pale, and I
Mm.
wonder if they might be deficient in something. So some will say that. Some will say that the behavior has just been really what they would call off. And so, it's tell me more, help me understand. Well, they're just like easier to get upset, or just showing those signs of fatigue, or perhaps the teacher has commented, they don't seem as engaged towards the end of the day, different things like that. And so sometimes it could just be actual food fuel, right? Perhaps they're just not fueling up enough. Sometimes they're not hydrating enough. But I do find quite often iron and omega 3 are top of the list for something that we can supplement,
Oh,
because
yeah.
there's not necessarily enough in the diet for whatever reason. Maybe they're a more selective eater, maybe their appetites are smaller, or maybe it is what we just spoke about, it's convenience.
Yeah.
They're willing to sit down and, eat a chicken breast with quinoa and broccoli. Maybe they're not a selective eater, but the time is the
Yeah.
difficulty, right?
Yes.
And every sport has its own version of the time intensity. For us, sometimes with hockey, it's more like the travel piece, and you have to be at the arena an hour ahead. Whereas there's others, they may not travel very far, but maybe they're in dance and they're there for 4 or 5 hours in the evening.
Yes.
So there's different sports. I find that there's different solutions available. Sometimes, not always, but sometimes there's a little bit of an anxiousness
Mm.
that parents will describe as well. I find this more in females than males, but certainly it can be both. And so I'll educate, right? That sometimes that is a sign or a symptom to us that there's some low iron in there as well. And so let's try. As a dietitian, I can't prescribe a large amount, like a prescriptive amount, but I'll often say, here's the amount that your child would ideally be having in a day. I don't necessarily think they're getting that from food. Let's just top that up and see
Yes.
if they're feeling better. And perhaps you want to go and get some blood work and see, are they already, do they have really low numbers? In which case you may want to up your
Yeah.
dose.
Because yeah, the therapeutic dose is very high for
It
three
is.
months, and then they
Yes.
retest.
Yes.
So what we would find in like a KidStar BioFe product is the maintenance dose, is
Yes.
what you're right, what you should be getting from the foods you're eating if you are eating them. But then
Exactly.
again, if we're talking about adding in another layer of like digestive issues,
Yeah.
then the foods you're eating, you're probably not even getting the iron from it.
No.
So then it's like a whole other layer of complexity of where you say, okay, well now I need to supplement a little bit more
Yes.
to make sure you are getting what you need.
Exactly. And I've had clients as well say, well, my doctor prescribed this amount, but I don't take it, or my child doesn't
Yes.
take it because it does hurt their stomach. And I say, okay, well, here's a solution. Let's at least get something into you, because this one, it doesn't cause your stomach to hurt. It's not constipating, and it's super absorbable, tastes great. You've checked off all the boxes,
Thank
right?
you.
So it's a perfect solution for families to say, let's at least get a
Oh,
baseline in. And I have a lot
100%.
of families who will say that their lives are different,
Yeah.
right? Because of that nutrient deficiency either not being as extreme or being alleviated altogether.
Oh, it's 100% true. And, we actually had the pleasure of doing a pediatrician show in June last year. And it was amazing because they kept coming by and they're like, we know our patients are not taking the products like that they're normally prescribing because they know they don't taste good. There's side effects. And so when they were trying our iron, they were like, this is a game changer because just taking it is step one. And if you don't take a supplement, it's not going to work.
No,
So they were like
no.
so excited. They're like, at least they're going to take it now.
Yeah, that's exactly it. My kids actually ask for it, in all honesty. They're like, our iron, is it around? I'm like, oh yeah, here it is.
That's my youngest. She's like, I want the liquid today. I'm
Yeah.
like, okay, sounds good. And then she's like, no, now I want the chewables. I'm like, you do what you want, honey. Pick one.
It's nice to have variety.
It's true. And that's why we did it, right? Like kids and adults, we don't like taking the same thing every day. We like a variety in our lives. And so, having different flavors and drops and chewables, it's up to
Yeah.
you what you want to do that day. Yeah.
I will say your tasteless drops. I have one significant story. I don't think I've shared with you actually. I had a little boy about a year and a half ago now, and he was a little 3-year-old. He was autistic actually, and he was eating non-edible things. Like he basically had pica,
Yeah.
and parents had no idea. They thought this was just part of kind of his choices. And so I explained to them, I can't diagnose it, but I really ideally would get some blood work done. And his iron was unbelievably low.
Oh.
But he's a very selective eater, and we were able to put the tasteless drops in water. And they were like, he's not going after eating diapers. He's not trying to eat paper. Like he really was showing kind of those true clinical signs of pica. And he then was not only not doing that, but he eventually started to have more interest in food, and he was feeling great. He went into like using some words. Like it's just been amazing to watch him develop over the past year and a half. And the iron was a big piece of that.
Oh, I love that. Thank you so much for telling me. Because it's true. It's why we did what we've done is,
Yeah.
my own daughter, she was so low in iron and we could not find a solution. And then when we were searching for different manufacturers and different delivery methods, and then we found that someone who could make the drops for us, we were like, this is going to be a game changer because even for like infants, the alternative on the market tastes so bad that parents didn't want to have to put their kids through that, but they knew they needed the iron. So now we have a solution where it's okay, we know our kids aren't going to be upset with us when we give this to them. It's going to work. And it has so many other, meanings in life now. So it's like it goes from one step to another. We actually did have one of the moms on one of our groups actually say the same thing about eating. So their daughter had such low iron. She started taking the iron products and then she actually was eating food on a regular basis afterwards because,
amazing.
Iron deficiency, one of the symptoms is not being hungry.
Yes.
So it's,
yes, exactly.
If you're not hungry, you're definitely not going to be eating iron-rich foods.
You're not going to fix that deficiency.
No. But, and people don't think about it until you've gotten either a diagnosis and you've gone online and you realize how many signs and symptoms are connected to low iron. It is frightening.
Yes. And the fact that there's not a catch-up available.
Yes.
So if we look at, kind of low calcium intake, and then we offer a lot, we see the bones can catch up a little bit, right? But there isn't that catch-up period for iron. So it is something that, you do a wonderful job of just continuing to educate pediatricians, like you said, parents, and helping people understand that importance of staying on top of it all the time.
Yes. Our big push lately has been on pregnant moms.
Yes.
Because, we don't even, I had 3 kids. I don't think that there was a lot of conversation about when your baby is born. They could be born with low iron. Like no one said anything to me about it until our daughter was diagnosed. And then they were like, oh, it was probably from birth. And I was like, what? Did anyone want to say that? Thank you for telling me now.
No, the education is so key. It's so key. And I say that to clients too all the time. Like it has the word kid in the name, but it's for everyone.
Yes. I know. Someone said, oh, but it has kid. And I was like, yeah, that means it's safe for adults. And she kind of looked at me and I was like, well, it's true.
If it's safe for kids, you're
you're fine. You could take this too. But yeah, and of course we do have we have some more adult looking labels on our iron products as well for the teenagers and the adults that prefer to have a more adult looking product as well. Absolutely. So it's actually funny. We had a parent call and they said, well, why are there 2? And we said, oh, some teenagers and some adults that don't have children. And she kind of said, well, that's silly. She's like, it's the same product. And I was like, yes, We
Yeah,
agree.
exactly. But you need to make it marketable.
Yeah. I was like, but I could see why teenagers wouldn't. So it's, we agree as you age, your preferences change. But
For
yeah.
sure.
And then I wanted to also talk about our digestive systems and knowing if it's working well. I do think a lot of adults don't realize they have digestive issues until they have kids.
Yeah.
And then, of course, that's the entire topic at the doctor's office is your kids' bowel movements. And then I think you start getting re-educated on it. So what are the things we should be looking out for, or what do you see a lot?
So it's an area I've done a real deep dive into recently because I do find it quite fascinating, this concept of our microbiome and the probiotics and prebiotics. So for anyone who's kind of new to this lingo, the idea of probiotics, those are good bacteria. And we all have tons and tons of both good and bad bacteria in our gut. And then prebiotics are the food for the good bacteria. So your new product has both of those in it, which I love. It's awesome. And really what we want to do is we want to feed the gut every day with both probiotics and prebiotics. And for a long time, like even back when I was in school 20 years ago, it was like, oh, you need a healthy microbiome for a healthy digestive tract. And that's true. We want
Yes.
good bowel health, right? But what we've seen more recently, and where we can sometimes infer some connections, even in areas where more research is needed, but we're seeing connection to almost all body systems. So we're seeing it can affect our immune health, our adrenal health, our mental health. And because of that, because of the connection to all the systems, it adds even more importance, right? And so some really interesting research was done recently. They took a group of toddlers and they had the parents fill out a questionnaire about behavior. And then based on that, they, kind of categorized the kids into those who were more kind of regulated in their emotions and those who were maybe a little more dysregulated. One's more likely to have a bit of a temper tantrum, which of course can be personality as well, right? But then they did test the microbiome. They tested stool samples and they looked, and there was a greater variety and amount of good bacteria in the stool of the children who showed greater emotional regulation, patience, and like less kind of temper tantrum. They also have done research that makes a connection between kind of emotional regulation in childhood and risk of mental illness later in life, and they see a connection there. So now the long-term research we need done is if we can support the microbiome of toddlers and preschoolers, are we then going to be able to see a downward slide in some of the mental health concerns that we
That's
have?
very
So it's like a
interesting.
big area, right?
Yes.
Like it makes my, like, even as I said it to you, even though I've been talking about it a lot lately, it makes my stomach like flutter with excitement of like, what can we do to help? And we know that having solid amount of iron and DHA are big areas as well, which I know you have in your both of those in your product
Yes.
lineup, and those are huge for mental health and then the gut health piece. And I think there's just so much that we can offer throughout the entire life cycle, right? It's not too late. So we talk about toddlers and preschoolers, but I'm like, if you're 65 years old and you want to improve your gut health, like do it. And it's not just about eating yogurt. Greek yogurt is great. Kefir is great, right? Like these are great, but it's sometimes not enough. We need to see a variety.
Yes.
And it's just, it's a young area of research. It's been known for years. There's areas, within the Amazon that have such amazing gut health. They like live on plantains. It's great, gut health, right? Here we are in North America, not really doing that. But there's a lot that can be done. And I'm often asked too, and maybe you've been asked this since putting the new product out, like, is there too much? And with a lot of nutrients, yes, we do. We have this idea of upper limit, right? But when it comes to probiotics and prebiotics, we're not really in a position to say too much. I would just say the greater variety, the better. So the more sources that you can, right? There's some research to show that over 40 plant varieties over the course of 7 to 10 days can really support a great microbiome.
Yeah. Oh, yeah. And they always say, eat the rainbow.
Eat the rainbow.
You want to make sure you have a variety of everything. And even in that, there's a lot of people that just eat the same meal all week long. Like they have their schedule. They eat X on Monday, Wednesday, Tuesday, Fridays takeout, let's say, and then they start it again.
Yeah.
So they may be eating great foods, but there's no variety
100%.
because they have the same thing every single week. So it's the same thing. It's, it's not always, well, I'm eating good food, but you haven't changed it.
Yes.
So you really want to make sure you throw some new stuff in there every once in a while. And
absolutely. And you can keep even like a basic routine, right? If people really say, well, I just I love just grabbing oatmeal in the morning because it's quick and easy. I don't have to think. Totally, that's great. But then, do blueberries one day and raspberries one day and strawberries one day and prunes one day, right? Like vary up what you can.
Something like a little change. Not dramatic, just a little change here and there to change it up a bit. Or at least when, even when people go for dinner to a new restaurant, a lot of people stick to what they like and know. Yeah. They don't even change it when they're not at home. So, we always do these webinars and talk about picky eating with kids. And I always say it's not just kids. No. But we just
adults too.
Adults just don't get told what to eat.
Yeah.
Like it's not like there's no adult being like to another adult, you should really eat the broccoli first or anything, right? Like they're the adult making their own decisions.
Totally. So. I've often said that to parents. I'm like, can you imagine if at dinner you kind of reach the place of satisfaction, right?
Yes.
And someone across the table said, you really should finish that, or, you're 37 more bites, or whatever.
Pretty much.
Right?
Yeah.
It's like, oh, no, I wouldn't say that.
No, exactly. And so to kids, they're just like, all right, yeah, I chose not to eat that. It's the same as the adult doing it. So, obviously we have to offer all the different varieties and everything, but at the same time, adults are just as picky and is just as selective as many kids. True. I think my husband hadn't even tried what we were eating it the other day. And he's like, the first time I tried this was with you and your family. Oh, it was beets. And I was like, really? And he's like, yeah, I never ordered it. I never really thought about it. And I never made it on my own. And I was like, yeah, you never, like, if you aren't brought up in a household that does certain foods.
Absolutely.
When are you exposed to them?
It's true. I was that way with avocado. It just wasn't really something my mom served. Like, it wasn't part of our meals. And I remember first trying it in university. Meanwhile, it was one of my kids' first foods.
You're like, oh yeah, but it's true. It is a lot of the times a baby's first. It's like good fats, good this. Easy mushy food. Yeah. But yeah, you're right. It's just if we're not exposed to it, we're not exposed to it. So it's not just kids.
It's not just kids. No, exactly.
But no, it's and I wanted to say again with the microbiome and our gut health, iron is digested and absorbed in the small intestine.
It is. Yeah, it is. So if we have inflammation in there, or if we have really just anything that has really bothered, so we have these villi and microvilli, and that's where the iron is absorbed. That's where we want the health, right? But if your gut isn't happy, then sometimes there can be damage to those, whether it be short term, like acute, or long term. Celiac disease is one of the big ones, right? Like iron deficiency is often seen prior to someone being diagnosed with celiac disease, and even for a little bit of time afterwards because the villi just lay down. But that can happen due to other reasons as well. And so we do want to make sure that we are keeping that microbiome nice and healthy for optimal absorption of nutrients. Absolutely.
Yeah. And it's, we actually did the celiac show in Vancouver a few years ago, and it was interesting how many parents came up and they're like, vitamin D and iron, vitamin D and iron. I think we stood there and we were like, okay, I guess vitamin D and iron is the need for the celiac population.
It is.
It was just really funny because they were like, finally a kids supplement company that can help our kids. And I'm like, this is amazing. And I think it was like year 1.5 for us of starting the company. I'm like, okay, we are doing, when you start a company, you're like, okay, I'm doing this for so many reasons. But as soon as you get the validation from, okay, and this group of people, they're getting helped and this population, and it just, it reminds you every time, okay, yes, we are doing something for the greater good.
Oh,
and
100%.
You keep going.
Yes. Like lives literally changed, right? Like iron is that type of nutrient, and really the probiotics and prebiotics are too. There is a difference in individuals' quality of life.
True.
When they're deficient, or when they're not deficient in iron, or not having enough variety in terms of probiotics and prebiotics. And like we said at the beginning, like you don't always know what your best feels like. I had endometriosis for years prior to having a hysterectomy, and we tried many methods, and in the end I really did need that for health purposes. But for years I had no idea
what
life was like without it.
Yeah.
And I often equate deficiencies to that. When you have a deficiency, you don't, it's just you're normal. You don't always know what, quote unquote, normal could feel
Yes.
like and how
Yes.
good you could feel if you had the energy level.
Yeah, and we found out my daughter had iron deficiency because of lack of sleep. Like she just never slept through the night. I always had to touch her. Like it was 24/7. And the first thing I said to the pediatrician is, I haven't slept in 2 years. And she said, oh, it's probably iron deficiency. And it was her iron deficiency that had me not sleeping. But as soon as she was able to sleep through the night because her levels were up, like
Yeah.
it was night and day. She could make it through the day. She could make it through school without having this feeling of constantly being drained.
Yeah.
And it is dramatic when you go from always feeling horrible and a little bit low, like always just in that little too low range, to being like, oh, this is how you're supposed to feel. This is how the rest of the world is feeling right now. No wonder.
A lovely thing. Yeah. I think it's interesting too, for that story is key for some parents, because we often hear about tired and lethargic, but your child wasn't sleeping.
Yeah.
Right?
Yeah.
And that sometimes can be a sign with kids, is the difficulty in falling asleep, like that insomnia.
It was so bad. The difficulty falling asleep, she had to be touching someone. And then she'd wake up frequently. So it was a 2-in-1. So there always had to be someone near her because, of course, as everyone knows, when your kids wake up at night, if they're awake too long, they don't go back to sleep.
And they're up.
So they're up. So it was one of those, everyone had to be very close to be like, okay, we got her within a few minutes so that she got back to sleep, because then everyone can go back to sleep. And everyone's, oh, they don't sleep. It's just a kid thing. They don't sleep. They don't sleep. Well, it was our second, and our first was an average sleeper. But she would sleep when she fell asleep. And so, it was very different. And then finally I was like, this can't be normal.
Yeah.
And then they were like, no, it's not. As soon as we had that blood test done, everyone's like, oh, there we go.
And then you have a solution.
Yes.
Right? You're like, sometimes the biggest thing as a parent, you're like, I just want to know what the next steps are to help my child. And when we don't know what is wrong, for lack of a better way to say it, it's very difficult. We can only support them to the extent of knowing what the true underlying issue is.
Oh, it's true. And my third had the benefit of me learning so much with my second about iron, that I was able to be like, okay, we're going to make sure at every meal, at this, at that, I'm paying attention to everything you're eating, because, they were eating great food, but not iron rich, and not enough, and not frequent enough for it to really do anything. And, if they're born with low iron, you really have to supplement, because it's going to be really hard to get that up with food. Yeah.
Yes. It's hard, and it remains hard. Like I find with Clay, who was my one that was born, the twins were both preemies, but Clay was the one that had the iron deficiency. And he's continued to deal with it. Like I need to give him, I don't give him a prescription, like therapeutic dose. I give him yours a slightly higher than what it would be deemed kind of just a maintenance dose. Right. And I find that keeps us out of the water. But some people are just, we have recommendations, right? We have DRIs, but they aren't the perfect number for everyone. They're based on tons of research, and they're really good, but you have to get to know yourself. You have to get to know your children. You have to figure out what dosage they need of certain things in order to be at their best. So that's the story in my home, and perhaps it is similar for you. I have two that I can just maintenance dose, even if I missed a day or two, like you wouldn't really notice a difference with them. And I have one that if we go away for a weekend and I forget to take them, by the time we get back, I'm like, oh yeah, really should have remembered that. Like I noticed, right? Even though I know it takes 3 months to build it back up, and it's supposed to take 3 months to make a difference. I find he dips so easily.
Yeah. And it's true. And our therapeutic dose when she was 2 was very high.
Yes.
As therapeutic doses are. Yeah. And so when I said to the pediatrician, oh, we're just going to keep her on a maintenance dose, and she's like, remember, her maintenance dose is not a maintenance dose because she had low iron. So she said her maintenance dose is actually, and she gave us the number based on her weight and everything. And she's like, that's hers. So remember that if you had low iron, really low iron, your maintenance dose is different than someone else's. So the one that's standard on the package is safe for everybody, versus if you had low iron, yours would be higher. So you're right. You do have to know, and you have to know what they're eating. Like
Yes,
if for
yes.
2 weeks they decide that it's not happening, we're not eating iron-rich foods, I'm not touching anything, then I definitely adjust our maintenance dose accordingly to their actual diet. Yeah.
Absolutely. Yeah. And these are all things that, you and I are educated in this area, and we still, as moms, have
Oh,
questions, right? And like, it's just so important for moms to understand that no one out there is thinking that everyone should just know how to do this.
oh no.
And it's so important to reach out to a healthcare practitioner that knows. Like, if you talk to one and they're really well versed in one area but not this, then you need to talk to someone
It's
else.
true.
You really need to make sure you have good support in order to get, these micronutrients where they need to be for kiddos.
Definitely. And every we see nurse practitioners for the kids, and every time we see them, because they spend so much time, they have a very different setup
Yeah.
for the way they do appointments. And I'm always like, and this and this and this, and she's like, yes. And then we kind of go through the whole list, and I'm like, okay, well, what about this? Because the more questions we ask, one, the more opinions we get, the more advice we get, and sometimes it spurs something else. You're like, I never thought of that. My kid does do that, but it wasn't on your radar.
Exactly.
And I always say, it's really hard to see things in our own children because we see
Yes.
them every day.
Yes. And you wear the mom hat.
Yeah.
Right? You don't wear the same hat, wear the same filter with your own kids
It's
as
true.
you do with others.
Yeah.
Yeah.
So, sometimes the unsolicited advice from grandparents and aunts and uncles, sometimes it's very important
Yeah.
because they see them maybe, once a month or less frequently than you do. You see your kid every day. So sometimes it just becomes, they're like, oh, they kind of look the same. But someone else looking at the family can say, oh, actually, you should probably check this out. So, as much as we don't like advice from some family members, sometimes you should listen. And just,
Sometimes.
with a grain of salt, just listen,
That's
listen
right.
to it.
Put it in the back of our mind.
Yeah, just a little bit of it. Not too much. But it's true because it is hard to see things with our own children.
Yes.
Yeah.
Yes. Absolutely.
But
Yeah.
yeah, no, nutrient deficiencies always are a big thing, especially with school age kids, because a lot of them are getting flagged for behavior issues, and sometimes it's not a behavior issue at the core.
No.
Or it is, but it's just being made, the symptoms are just worse because of nutrients. So, when you get families like that in the office, is there any tips and tricks or things you might get those parents to look deeper at?
Absolutely. And even if you think of us as adults, like I know for myself, if I'm exhausted, right, or really hungry, right, there's a reason there's a term hangry.
Yes.
It affects, if we are not as nourished or rested as we ideally would be, we're not as patient, we're not as energetic, we're not as even able to think as quickly or retain information. And these tiny humans are the same, right?
Yes.
Like they're just trying to figure the world out. And if if their brain really just doesn't have what it needs, then they're not set up for success. And so I think one of my biggest message with parents, if let's just say we're dealing with like behaviors of like selective eating and kind of some outbursts in the classroom, that kind of thing, I like to think of two pillars. So on the one pillar, we're going to start talking about the behavior side of things. And we are going to talk about ways that you can help your children experience all these different foods with all of their senses. And we're going to talk about, strategies in terms of the behavior side, all of that, meal times, all of that. So there's that piece. But I say to them also, this other pillar is to help make sure that their nutrition is as close to possible as it can be,
right,
while we're working on this. Because as a parent, as soon as like, oh, okay, they're getting the nutrients they need, there's like a calmness that comes over us, and therefore we're not putting that pressure at meal times. Like, aren't you going to try a little bit of a bite? Or, oh, they don't like this, maybe I'll make this.
just lick
You're
it.
able to just chill a little
Yeah.
bit and be like, oh, you don't feel like that tonight. That's okay. It sounds like you're still learning to like that, or you don't feel like that right now. No problem. And you're able to just take a posture that actually opens the door for the child to be like, oh, well, maybe I will try that next time. There was less pressure. Because over here, we've got supplements. And again, the iron and the DHA are two of the top ones that I typically will say, those are the least likely that your child is going to get enough through food,
Yes.
even in an interested eater. And as soon as we have a selective eater, it's nearly impossible. And possibly with the probiotics too, depending what their willing to eat in terms of textures and tastes and that kind of thing. So I talk to them a lot about two pillars. Let's nourish the child through supplements for now, knowing that if we want to pull back, we can.
Yes.
But let's meet those needs to take your stress off. And then let's look at beautiful ways to explore. I always say curiosity and comfort. Curiosity and comfort. Create curiosity. Help the child want to touch the food, right? Leave them space for that. And also comfort in terms of like, hey, they help make the salad, right? They touch the peppers, they touch the spinach. Even if they don't eat it for a while, they touched it. And that creates comfort with the food. And if we have a more nourished child, as we talked about before, they're actually more likely to have interest in those things. They're not coming to the dinner table so done in because they're exhausted from the day and low iron.
Yes.
They actually have a better headspace. So it really, they're separate pillars, but they really do align. So that's a conversation I have regularly. I sometimes, joke around with, I know, my business partner, Angela, I'm like, I could just like record this. I wouldn't because I really like chatting with them. But I'm like, the message is so similar. But I also love working with parents because they often feel alone. And I'm sure you find this too, talking to parents about iron. They probably say like, oh, I thought my child was the only one that was this deficient or this picky. And they're not. There's such a community. And I think you've done a really great job of pulling together that community, right? Into this common space of like, oh, there's a lot of us actually that are dealing with some of this. And to no fault of the parent. That's the other thing. I think it can be really easy to own it as like, I've done something wrong, right? This is my fault. Like, no, you have a child who's maybe a super taster, or maybe they don't absorb iron well. There's all these different reasons behind deficiencies and likes and dislikes, and just comforting parents to be like, hey, it's not your fault. Like, just you can be part of the solution.
Iron is the number one nutrient deficiency in the entire world. In the world. And then I know they just did a study at UBC, and 80% of the pregnant women in the study, they were all taking a prenatal, had insufficient iron for their pregnancy.
No
insufficient.
Way.
So like it's everywhere. And if we don't talk about it, people just pretend, oh, I've had low iron forever, and I just gave up. Or I've had low iron, so my kid has low iron. But it's really important for their brain. So important for their brain. Obviously, oxygen moving through the body is also important. But, some things can't be reversed after certain stages. No. Of course, we can help symptoms later on. But, we really want to focus right away. We want the pregnant moms to know so that they can look out for it.
Yes. And pregnant moms may or may not know that there's tons of iron passed in that third trimester. So if you do have a preemie, they don't get all of that, right? So there's that piece. Or you do have a term baby and you've given them a ton of iron. It's always bothered me a little bit, the DRI actually for postpartum, because it goes down, and yet these women have given tons of iron over in third trimester. You've lost blood during childbirth, right? And so here the recommendation goes down significantly when you could be entering into this stage deficient.
Well, that and the amount that they're telling you to take is a maintenance dose. So if you don't have a ferritin of 100, that maintenance dose is doing absolutely nothing for you during that pregnancy. Yeah.
Yes, it's a problem. And there isn't a caveat in there as well. It says lactating women.
Oh, I know.
Nothing about if your cycle returns.
I know.
Right? So, I mean, really, you need iron even before then, but once your cycle returns. So that to me is a big education area as well that I'm sure you've done a ton of. Just
people always
really helping.
Say, why is it less? Why do they need less iron? And I'm like, they don't.
No, they
I'm like, I've given up. They don't. Just take the other amount until you stop breastfeeding, or get your iron checked and see how much more you need.
Yes.
Because you're right. It's, it's like an arbitrary, okay, let's just take, 8 milligrams less now that you've had the baby.
But what if you're deficient, right? Yeah. Just so important to get that blood work done. I posted a question box earlier, and you did give the answer to this earlier, but I want to make a point of saying it. Someone asked me how long between blood tests.
Oh, yes.
So for anyone else wondering that, we usually recommend about 3 months, just because that's the cell turnover, 3 to 6 months, anywhere in there. And then you can get a true read on if it's making a difference.
Yeah. And for adults, I try to go to the doctor about, every 18 months ish. Yeah. And so at that point, just as an adult, you can just get regular blood work done,
Yep.
and you can know your own numbers, which is
Yes.
good. Yeah.
And
You
for
don't
vitamin
have
D.
to be deficient to ask for your numbers.
No, you can
Yeah.
feel okay and still know, because that also gives a baseline,
Yes.
right? To what your kind of normal is. And
Yeah.
sometimes I will have people say, well, I have these symptoms. Have you ever gotten tested? Well, yeah, like I was fine. I was within normal limits. And I'm like, well, if you're not feeling great, then
Yes.
what if we tried a little something and see if it makes a difference?
Right. And
because
yeah, and they did change the ranges in Ontario.
they did.
So
Yes.
it used to be, I think the low for adults was like 15, 10,
Yeah.
and now it's like 30.
It's up
Yeah.
there. Yeah. It's either, I was going to say 20, but it might actually be 30.
Because the kids
Yeah.
one changed too, and I'm not sure which one's which. But like, and then for BC, our normal ferritin is 100. So your optimal is 100 for our life labs in
Wow.
BC, and then anything below is possible, not yet, that kind of thing. And then it's iron deficient. And then iron deficiency anemia along with your hemoglobin. But it says optimal, like your normal range should be 100.
There is
100.
so few Ontario women with that, because so many have been told at,
Yeah.
25, 30, 35, like,
Like
oh, you're fine.
you could get an iron IV in BC with 25. That's low.
Isn't that interesting?
So, you're not feeling good. You're probably losing your hair.
Yeah.
Your thyroid's affected. You're not
Yeah.
eating properly. You're super moody. If you're been prescribed antidepressants without a blood test, you should go back and get a blood test to
Yes.
see how low your iron is. Because, if everything's going hand in
Absolutely.
hand together, you really need to know your number is
Yes.
the biggest part.
Yes.
Yeah.
I shouldn't roll my eyes, but that's the way I feel about so often
Yes.
about ADHD in kids as well. Right. And yeah, anxiety, and when people are experiencing depression, they're all very real. And sometimes medication is needed,
Yes.
but sometimes nutrient deficiency is the underlying cause.
Yeah.
And so then we're not actually solving
No.
the true issue.
And they
right?
could be hand in hand. You could have your true diagnosis, but then your symptoms are just so much worse.
They're exacerbated because
Yeah.
of your nutrient deficiency.
Yeah.
Yes. There's actually a new area also in the area of mental health called neuroinflammation.
Ooh.
And it is a new kind of category of depression diagnosis. And looking at the idea of anti-inflammatories in the diet and through supplement is one of the first kind of lines of defense against that. It's a whole new category. It's super interesting.
And that's a great thing for parents too, because when you can make small changes in the diet, not huge ones, small changes, and you see your children act differently, it's dramatic, and it makes you feel good too.
Wonderful. Yes. And their ability to retain information in the classroom.
Oh, yes.
Right? And keep that in and move forward and succeed more academically and in athletics and even socially. Right? Sometimes children who have an iron deficiency may not be able to think on the spot as quickly, and then they may make a more impulsive decision. And once the iron levels are up, they might be just a little less impulsive, and it can even help in the social area of things.
Yeah, no, it's pretty amazing what nutrients can do for us, and how most of the time we just take it for granted. It's just food, but it's not just food. It is what's fueling our bodies, and it's what's making our kids reach the potential that they can reach through their life, because they're always growing. They're growing from in utero, like 18, 19 years of age, maybe longer.
Yeah.
And it's hard work to grow a human.
It is. We're working hard when we're growing them. They're working hard once they're growing on their own.
It's so true. I'm like, it's just never ending.
Never ends.
But I wanted to say, as I'm coming to an end here on our Instagram Live, thank you so much, Noelle. It's always a pleasure to have you on, and your wealth of knowledge. And of course, our favorite topic is iron, so it's even better. And this time we got to bring in some gut health, prebiotics, probiotics. If anybody is watching, we do have a promo code for the KidStar website. It is Try KidStar. And I believe it gets you 15% off, and it's on the US page and the Canadian page. So we do ship to both countries. So just make sure you have the right flag at the top, and you are able to get KidStar products across the border.
Is a really excited new piece for you
Oh,
guys. I'm so thrilled that people in the United States can access them so easily now too.
Yeah, no, it's been great. Oh,
We have a question here. My son is anemic. I ordered the BioFe Iron drops and have been giving him drops in his drinks. Thank you so much. There you go.
yay! Love it.
Hey, that's amazing.
Oh, and there's our code right there. So try KidStar for 15% off. So make sure you do head to the website for that. And then, of course, if you're not subscribed to our newsletter, make sure you do so because I believe there's some fun things happening this long weekend. So, check your email. And then, of course, if you're not already following Noelle, make sure you do head to her page as well and click the little follow button.
Thank you. It's been such a pleasure to chat with you.
Likewise. Have a great week, everybody. Thank
Bye-bye.
you.